Okay, so this video is going to be about sexual dysfunction, right? So this is different than variations in sexual behavior. That was more about difference in interests and the types of activities that might lead to arousal. This is going to be more focused on if we look at the sexual response cycle, those 4 stages. These are dysfunctions or areas of problems and issues or disorders that relate to kind of those different stages, right? So there's a common misconception, right? So when we look at like TV and movies and stuff like that, they often portray sex as effortless. But in actuality, these difficulties are quite common, right? So approximately 1 in 3 Americans experience some type of sexual dysfunction during their lifetime, right? So 33%, that's a pretty high number, okay? Now, when we look at defining what a sexual dysfunction is, we can turn to the DSM-5, right? So the Diagnostic and Statistical Manual of Mental Disorders. This is what we use to diagnose somebody. And so they will define a sexual dysfunction as something that causes clinically significant disturbance in the sexual response or pleasure. It causes personal distress, or it interferes with relationships or some kind of part of your daily functioning. Okay, so the emphasis that we want to make sure that we're having here, though, is that not every variation in sexual desire or functioning is a disorder. Okay, a diagnosis requires, again, significant distress. It's persistent, right? So usually there's a time period, let's say 6 months, that are involved. All right, and the symptoms are occurring in most sexual situations, right? So the distinction is that differences in sexual interest are not automatically pathological, right? Those other things need to be present. Now, what can cause these problems, we can turn to the biopsychosocial model, right? So it's going to look at 3 key areas: biology, psychology, and social and relationships. Okay, so from a biological standpoint, factors may include things like hormonal changes, if you have a chronic illness, or things like cardiovascular disease, neurological conditions, side effects from medications even, and then just general aging and getting older. All these can impact our sexual desire and pleasure. Okay? There are psychological factors, right? So anxiety and depression. If there's a history of trauma, if someone is struggling with body image issues, experiencing stress, especially if we look at something like maybe performance anxiety when it comes to sexual activity. Okay? And then third, when we look at the social and relationship factors, right? So is there conflict or communication issues? What are your cultural beliefs or religious messaging around it? Are you experiencing kind of stigma? Is there like a privacy, whatever have you, right? So one helpful kind of visual is if we take these 3 areas, right? Imagine a circle for each one, and we create a Venn diagram, right? So we have biology, psychology, and then the social environment, and at the center of it, we have sexual functioning, right? So as an example, if we have a male who's experiencing erectile difficulties, right? It could be impacted by maybe their stress at work. They're on an antidepressant medication, so we're maybe seeing possible side effects, or there's a relationship conflict, or all of the above, any kind of combination, right? So rather than one single cause, we want to look at kind of a holistic approach in trying to explain what we're talking about, what the person's experiencing. Now, as far as those are the causes potentially, but what are the actual dysfunctions, right? So some of them are what we call disorders of desire, right? So this is where there is low or maybe even completely absent no sexual interest whatsoever, or there's interest, but there's difficulty experiencing desire, right? So we can kind of separate those out actually, right? So disorders of desires. There's also disorders of arousal, right? So these may include things like erectile dysfunction, or with women, just difficulty becoming physically aroused, okay? There are disorders related to orgasm, right? So there's delayed orgasm. There are completely absent orgasm. And then there's also, for men, premature ejaculation, right? So the orgasm happens a lot sooner than anticipated, a lot sooner than desired. Okay? And then with females specifically, that we won't see this with males. Females specifically, we have genitopelvic pain or penetration disorder. So this is where pain is experienced during intercourse, and it's usually due to muscle contractions and tightening of the vagina during intercourse. Part of that could be some type of fear or maybe even anxiety related to penetration. And so it's difficult for them because they do experience that pain or the anxiety about the penetration, right? So it's almost like their body is going in and fighting it off for them. That's why you have the muscle tightening. It's hard for sexual intercourse to take place. What we want to kind of keep in mind with all this is that many sexual dysfunctions are temporary. Okay, they could be situation specific, and I think the important thing is they are treatable. Right, these are not permanent conditions; they are treatable. Okay, so it's not uncommon for someone to experience difficulties, let's say like maybe after childbirth, okay? Like we said before, during moments of high stress or even while taking certain medication, right? So we just want to kind of normalize as much as we can some of these temporary changes that we may see in sexual functioning. Okay? Now, as far as treatment for someone who's experiencing one of the things, it really is going to depend on the underlying cause. Again, that's why we want to have a holistic approach. But even then, there are different types of treatment. From a medical standpoint, maybe we look at current medications and how they can adjusted, eliminate some side effects. Or maybe we need to prescribe a medication. So if someone's experiencing erectile dysfunction, Viagra or similar medications may be appropriate. Or if there's not necessarily a medication issue, but there's a medical problem that's causing the sexual dysfunction, what can we look at there? All right, can we treat that medical problem? From a psychological standpoint, we can do things like CBT therapy. We want to address whatever the anxiety or the trauma may be contributing to it. We also see things like mindfulness training, particularly if there's performance anxiety, right? And how can we overall just reduce any stress that's experienced with sexual functioning? Now, with the psychological treatments, there's a specific type of therapy called sex therapy, right? So you go see a sex therapist, and their kind of goals is not necessarily always working individually. It could be working with a couple, right? So we want to improve communication. We want to reduce that performance anxiety that we mentioned. We want to increase comfort and intimacy and address whatever the specific concerns may be, right? So, for example, one technique is called sensate focus, right? So this is where couples are encouraged to focus on touch, comfort, and connection rather than performance or orgasm. Okay, so just as an example, a couple experiencing anxiety around intimacy might begin with non-sexual touch exercises before progressing to more intimate activities. Okay, but again, the treatment is going to be specific to the individual, and we want to have it more of a holistic approach. Okay, and then with this, we just want to do everything we can to reduce stigma, right? So I think most of us understand that with these things, embarrassment tends to be kind of common. Sexual concerns, though, are common. And so we want to see how we can establish healthy communication and increase the number of people willing to seek treatment. Okay. All right. So questions to finish this out. Again, just reflection or some critical thinking for us. How does viewing sexual dysfunction through that biopsychosocial model change the way you think about treatment? Okay. And then what barriers might prevent someone from seeking treatment? And then how can healthcare providers and others eliminate those barriers, right? So how can they provide a more welcoming environment potentially? Or how can we change the way we think and act to help reduce the stigma? What are some possibilities there?